Okay, this station we're going to go over the code cart, and we're going to review the contents of the code cart. So we will go through what is located in each drawer. And then we are going to go over some of the NRP requirements, and that would include going over the epi dosing and drawing up epi, setting up a UV line and where to get the contents to do that, as well as setting up for a thoracentesis. And we will show you how to do that, where to get the equipment. A few points of emphasis for the code cart before we start is whichever institution you work at, please know the location of your code cart. And also, with NRP guidelines, if your role is to take care of the code cart and you're manning the code cart, that is what you're doing. You're not doing other roles. So the person at the code cart should be able to remain at the code cart and just go through the drawers and be able to communicate with the providers and the team that's running the code. So those are just a few points of emphasis that we want to make sure everyone is aware of. So first and foremost, we will go through the contents of each drawer. These are the neonatal code carts as they are throughout our hospital. They are a locked cart. You just crack the side here, and you will notice that each drawer is actually labeled with its contents. There is also a map on the top of the code cart that shows what is located in each drawer and the contents that is there. But for purposes of this skill station, we just want to make sure everyone's comfortable with what is in it, and then we'll go through the skills. So the top drawer are our meds. So if you're in a resuscitation situation, drawers 1 and drawers 3, I'm just going to tell you just as a point of emphasis, meds and lines are probably your most go-to drawers because you're going to get your epi ready and you're going to get your UVC set up. And that will make more sense as we go through it, but just as a point of emphasis. So top drawer, what is located in our top drawer are our code meds. Again, this is what is in the throughout our hospital, so we do have code meds, although that's not part of NRP, so we won't be discussing those doses, but we're going to go over epi, the dosing, and how to draw it up. Also in this drawer is for documentation and labeling meds, which again, you want to make sure you're always using closed loop communication and labeling your medications. There's pens and labels. There's ID bands, which are if a mom and baby come off, do not get to go through OB admitting, you can label mom and baby so they're matched. There's also needles here. If you are drawing up from, if you say normal saline, bullets are here, but we more likely are going to use this part of the drawer, which is already pre-filled normal saline flushes, which are great for flushing your line after you give your epi, which we will go through. You have TB syringes, stopcocks, and your fluid dispenser in the top drawer, and those are all the items you need to prepare your epi. And we're going to come back to that and actually do it, but I just want to go through the whole code cart first. The second drawer is IV and labs. So in this drawer, if you were in a situation where you needed IV access or labs, this is your drawer that has all those contents. To note, if you're in a code situation, you would be needing to get central access, a UVC or IO. A peripheral IV would have no place in a code situation. But just so you know, this drawer does have everything you would need to set up for an IV, including warming the extremity, your tourniquet, alcohol wipes to prep the area, your catheter. We have a 24 gauge catheter, and also your syringes, gas syringes as well if you're getting a gas for labs, and then tegaderms to secure your IV, and then an arm board as well if you need to stabilize your line once you get it in. So that drawer is for setting up for an IV, peripheral IV, and drawing labs. Third drawer is lines, which we'll come back to show you how to set a line up. But just for content, you have your actual UVC 5.0 and 3.5. You have a blade, tongue depressor, and your blade to cut the cord to prepare for that, which in NRP you'll go over putting a UV, but we will. The equipment is here to get that. Also, to clean the site, you have your betadine, the stitches, and what you would also need for setting up the UV. You go back to your first drawer, and you're going to have a normal saline pre-filled syringe and a stopcock. But we're going to go through that a little bit in more detail. So UV lines are here. Also, if you're in a situation where you have abruption or you think you're needing packed red cells, this is where you get your blood filter. And also there is packaged syringes. So if you order a package of emergent blood, this filter just spikes the bag. You put on your syringe on the end and you draw back the amount of blood, which is 10 per kilo, and you would give that through the UV. But that is where the blood filter is located. Also, if you're in a hypovolemia and you're doing a fluid resuscitation, you also have a normal saline bag in here as well. So that is lines. So this drawer you'd be able to set up what we call the darts, but if the provider's performing a thoracentesis, we'll show you how to set up the dart from this drawer. Also in here is extra suction catheters and angiocaths as well. And we will come back and also I'm sorry, in this drawer too are the Repogles. So if you're in a situation where you're giving prolonged PPV, you need to remember to decompress the belly, and you can find the Repogle here in this drawer. And then this drawer is our respiratory drawer. So basically most of this equipment would already be at your bedside, but if you are in a situation that you need emergently to get any respiratory equipment, that would be in this drawer. So you have your laryngoscope and blade here, and you can check the light before to make sure that works. So you have your stylets if you're preparing for intubation. You also have your O2 sat probe, so if one is not at your bedside and you're in a situation, you can get that from the code cart. We have oral airways here, so if you're dealing with the Roban or microanthia, you can find your oral airways in that drawer. As far as prepping for tape, you have your blade here, your Cavalon, and tape, and that will make sure that you secure your tube once it's in. You also have extra masks. You have all your neonatal size masks here. You have small, large, and your neonatal round. That all lives here in this drawer. And then you have your ET tubes as well. You have 3.0, your 3.5, and your 2.5 ET tubes. So respiratory drawer, if you're intubation, this is where you're going to get your equipment. And you also have extra flow inflating and self-inflating masks here. There's also a stethoscope, bulb suction. So again, if this drawer is needed, if you come to a situation where you come to a bedside and you don't have the equipment, which should already be there, but you could always open your code cart. So you can utilize your code cart for many things. And then the bottom drawer actually has a full UVC kit. So we're going to go over setting up a UV line from drawer 3, but you can also grab the whole UVC tray as well. And there's extra equipment in there. There is extra gloves in here, suction canister, glasses. There's also dextrose. So this drawer is used less often, but it's good to know just what's in there. Extra fluid kits and safety gear in that drawer. Okay, so now what everyone should be able to do is know the epi dosing in NRP as well as how to jar up epi. So when you open the code cart drawer and you're preparing to jar up epi, you want to make sure you grab 3 items. You're going to grab your actual epi dose, and it should be the 0.1 milligrams per ml dosing for neonatal. You're going to grab a TB syringe, and then you're grabbing a fluid dispenser. So those 3 items you need to get for jarring up epi, which I'm going to show you. And then also always make sure that you either delegate somebody or have, make sure that you're actually labeling your medication. So you open your box of epi. You're going to flip off both bottoms And then this, be very careful, this needle has to access that plunger in order to access your medication. So you just twist, put that there. Next is your fluid dispenser. You take off the caps and you take off the tip of your epi. And you can see your medication's already flushed through, which is great. Put your fluid dispenser on. And then the next item, your third item, is your TB syringe. Make sure to remove the needle, and you have your luer lock end that goes onto the fluid dispenser. Secure that, and then you just, you can push with your thumb and pull the plunger, and you can access the dose that you need. I'm just going to draw back to 0.6, and then make sure you get rid of any bubbles. We recommend you label your medication and make sure you hand off with closed loop communication what the medication is and the dosing. And that is how you draw up epi. And then the other piece you need to remember is you always need to be flushing after you give the dose of epi. You will be flushing the line with 0.5 to 1 mL of normal saline to clear the line. So that is drawing up epi. I'm going to push that over there. The next thing we want to make sure everyone's comfortable doing, another kind of the high risk, like low frequency item, is setting up a UV line. So you would need, again, 3 items. You need the UV line. You need, let's go back here, a stopcock. Whoops, sorry. Stopcock, and then a normal saline flush. So when you're getting ready to, help, if you're at the code cart and they're asking for a line, you want to stay as aseptic as possible, even though I know it's emergent, intervention. You're going to open up your line a little bit. Then you just make sure you have saline and then your stopcock. Obviously, you would have gloves. Keep it in the package. Keep it as sterile as possible. You're gonna get your flush right on there, and then flush it in the bag, in the package before you. Oops, sorry. Close it off so you can. And then make sure it flushes all the way through. So that is a flush line. So 3 items: the line, the stopcock, and your normal saline. So then when you hand it off, it's still in the package. So everyone should feel comfortable prepping a UVC line. That is how the emergency meds are going to get to the baby. It's very important to know. So that's prepping the line, the UVC line. Then the next thing we want to be aware of how to set up is the for thoracentesis. You want to make sure you know how to set up the proper dart. So you would need a syringe, just a 20 ml syringe, a butterfly, and a stopcock. So again, 3 items that you would package together, and as they are prepping the area, because you would be cleaning with betadine, you need the syringe, and then the stopcock, and then the butterfly. So those 3 items are what you need to set up for a thoracentesis. Okay, so that's what it looks like. That's what you can prep. You can prep more than one if the situation calls for it. But that is all available in the code cart, and it's available to be set up as the person who's kind of manning the code cart. So basically, those are the main items and contents. These are the kind of the 3 things that are the high risk, low frequency, epi, UVC, and a dart for thoracentesis that you should be able to feel comfortable and confident setting up. Any questions?